Well, the yearly cost of diabetes is over $900 billion globally. So
Wow.
it's a lot. Lifestyle changes can make all the difference. And according to the American Diabetes Association, getting active is probably the best way to combat the insulin resistance. And when people commit using Olakino app, they can lower their insulin resistance. And especially type 2 diabetics can live with less medication, or they can even get their diabetes in remission. So that way they won't be needing any medication or extra insulin.
Welcome to the 10th anniversary season of Swiss Impact with Banerjees.
This season, we bring you the movers, shakers, and visionaries who are redefining industries and turning investments into real lasting impact.
These are the investors changing the game, driving sustainability, transforming lives, and proving that profit and purpose go hand in hand.
Every investment is a choice to shape the world we leave behind. If you're ready to be part of something greater, to invest in impact, to invest in hope, to invest in change,
this is where your journey begins. Welcome, dear viewers, to another thought-provoking episode of Swiss Impact with Banerjees. Whether you're tuning in from Europe, Asia, the Americas, or anywhere in between, thank you for being part of this journey. We bring you today amazing visionary.
Absolutely. And what a journey it has been. Our show has already reached over 5 million viewers worldwide. And that's just the number we can track. The real impact is far greater, touching lives in ways we can't even begin to measure.
So what do we have lined up for you, our viewers, today?
So today we dive into a topic that's transforming our lives at an astonishing speed. A force so powerful, so deeply woven into our daily routine, that imagining life without it is almost impossible. I'm talking, of course, about artificial
I was
intelligence.
wondering, is he talking about AI or what else?
From assisting us with emails to drafting entire business plans, AI is reshaping industries, redefining human potential, and yes, even revolutionizing our health.
Wait. AI and health? That sounds intriguing. I mean, I like to think I know myself better than an algorithm. So why would I need AI guiding my lifestyle?
So I hear. But imagine this, an AI-driven personal health coach, analyzing your habits, fine-tuning your diet, personalizing your fitness routines, and nudging you toward better well-being. Not just reactive healthcare, where we treat diseases, but even preventive care, where technology helps us to stay healthier longer. The future of healthcare isn't in hospitals, it's in our hands, powered by AI.
Well, I definitely believe it's not in hospital, but in our hands. So that sounds like something straight out of scientific movie, but it looks like it's already happening, isn't it?
Exactly. And today we have an extraordinary guest who is leading this transformation, a visionary who is redefining digital health and making well-being truly accessible for all.
So, ladies and gentlemen, let's welcome a true innovator in this space, Paulina Kario. Paulina, welcome. Are you here with us today? Hi. Where are you right now?
Thank you for having me.
So where are you right now?
I'm in Helsinki.
Paulina, before we jump into questions, I'd like to briefly introduce you to those who don't know you yet.
Mm-hmm.
So you are the founder and CEO of Olakino. Mm-hmm. You are on a mission to empower millions to take control of their health before illness even begins. With a deep passion for preventive healthcare, you have built Olakino Health Trainer, which is a smart AI-powered wellness platform that tailors personal health guidance to each user, whether you're managing diabetes, preventing chronic illness, or simply optimizing your well-being. Olakino app is revolutionizing the way we approach health. And your journey has been really fascinating and blend of science, technology, human-centered innovation, from leveraging AI and cloud computing to creating a health experience that is personal, engaging, and very important, effective. Olakino is more than an app, it's future of wellness.
And today we will explore your vision, the future of digital health, and how technology is making healthcare more personal than ever before. So let's get started.
Absolutely. We are so thrilled to have you with us. So, Paulina, every great innovation begins with a personal story. Beyond your titles and achievements, who is Paulina at heart? What inspired you to create Olakino?
Well, I'm really an enthusiastic about healthy living, right nutrition, movement, and all about a healthy lifestyle. I'm curious, calm, grounded, and loving to nature in all its form. And as I said, we live in Finland and we have all these different seasons here. So I'm very much a summer person, but I also love the cold and the winter season. For example, I love cold water swimming, and this morning I was swimming in the sea as well. It was like the temperature outside was like minus 14 at the time. But it's really something really nice, and I love it what it does to your health and also to your mental clarity.
And the water temperature was what?
It's about 4 degrees, I think.
Oh God.
Wow, that's really tough. So we see you have a very warm heart. Otherwise, you wouldn't be able to do that. But Paulina, what inspired you to create Olakino? So what was the story behind that?
Yeah, so I believe that the human body is able to heal and cure itself, but we need to do our part in helping our own way in our body to do that. So I want to make an impact on diabetes care, and this is our contribution to that.
And do you have diabetes in family or something? Because, for example, in Asia, diabetes is very, very predominant. It's spreading like anything.
Also in UAE, in
Middle East also.
Yeah, like the interest in the health technologies comes more from my personal interests, because my background is like from the finance world and e-commerce, and the interest in diabetics comes also from my family side. Yeah. Okay. And also because it's a big issue in the world, not just a family issue, but
many entrepreneurs want to solve something which outside world couldn't help to solve them, and then they create an enterprise. So that's a lot of stories like that I hear around. And tell us about the name Olakino, because it's quite unique. What does it mean, and how does it embody your company's philosophy?
Olakino is actually Hawaiian, and Hawaii is a special place in my heart. The word Ola means life and health, and Kino means body. So Olakino means health for the body. And that's what our company is all about. Health and helping people feeling healthy.
That's nice. What we've seen and heard that Olakino is not just another health app, because there are many, but it's a personalized health trainer. Can you walk us through its core mission and how it stands out in the crowded wellness tech space?
Of course. Mostly the diabetes care is taking care of the symptoms and not the disease, like the root cause. So what we are trying to achieve is to lower the insulin resistance, and that way have impact on the disease itself. And when the user's insulin resistance is lowered, the need for medication is also reduced. Lifestyle changes can make all the difference, and according to the American Diabetes Association, getting active is probably the best way to combat the insulin resistance. Okay. So it can be walking or stretching or then it can be running.
Okay. And right now, I read that over 537 million people are living with diabetes, and many of them is even undiagnosed. So how does Olakino help in early detection and management?
I encourage everybody to check their blood glucose levels on regular basis. And with this new technology, it is also possible to monitor your blood glucose continuously. You can put the patch on your arm, or later this year, there will be a new device which is non-invasive, like a wrist device, like a wristband. When you are using any of these devices, you can start monitoring your own blood glucose levels with our app. And Olakino app also shows how different exercise or different kind of meals affect your blood glucose levels.
And that will also help you detect diabetes.
Mm-hmm.
Okay.
That's
So
seems to be very.
So we aim to get people more active in their everyday life. And
So then the app gives you tips like, okay, today you should walk, you should stretch, and it's personalized depending on what app is measuring. Is it correct? Yeah.
yes, exactly.
Okay. Is it already available in App Store? Like, can people already try it out?
No, it's not yet. It'll be in a few months' time.
Okay.
Okay.
Yeah.
That's good. So we need to prepare to warm up everyone to try it out. One of the biggest global challenges is actually also rising healthcare costs due to chronic diseases like diabetes, what you're talking about. So how can Olakino potentially also reduce these expenses on a large scale? How do you see that?
Well, the yearly costs of diabetes is over $900 billion globally. So
Wow.
it's a lot. And when people commit using Olakino app, they can lower their insulin resistance. And especially type 2 diabetics can live with less medication, or they can even get their diabetes in remission. So that way they won't be needing any medication or extra insulin. The cost of insulin for one person in the US can be over $3,000 per month. And using Olakino app, the cost is only $20 per month.
Wow. And especially with so many people in US not having an insurance, this would be very helpful. Yeah. That's very true.
Right. And how about the privacy and data security? Because, of course, there are huge concerns in digital health about it. How does Olakino ensure that user data is protected?
We follow all privacy laws like GDPR in Europe and US data privacy law. And the data security is very complex thing. And we have actually our own privacy and security officer to do that all. And we are also using something called NIST security framework, but it's something that I'm not an expert with.
And you are using AI to personalize health recommendation. Can you share how AI and machine learning enhance Olakino's effectiveness?
The Olakino app collects the biomarkers from different wearable devices, such as the continuous glucose monitor device, like Abbott Libre, for example, and wellness devices like Apple Watch and Oura Ring. And then Olakino app analyzes these biomarkers using AI and suggests exercises that are tailored for the user based on the biomarker analysis. The same exercise can have different reactions on different people, as I said earlier. So therefore, the only way to find the right exercise for each individual is to analyze the biomarkers continuously and adjust the exercises then.
And what is Aura Ring, which you just mentioned?
Oura Ring, it's a smart ring.
On your finger?
Yeah, this one.
Huh.
Can you see?
What does it do? Yeah.
Well, it monitors all different kinds of your heart rate and your sleep and and your body temperature, your stress.
Wow.
And Pauline, I have another question about engagement, because many people download health apps but don't stick with them. So after some time, they don't use it anymore. How does Olakino will be keeping users motivated to sustain their wellness journey in the long term?
Positive results the user gets from using our app, I think that is the best motivation to keep using it.
So you can also see, for example, how I was 2 months ago, how I am now.
Yeah.
Oh, perfect. So it will make a kind of graph.
Mhm.
And where do you see Olakino in the next 5 to 10 years? So what is your ultimate vision?
The big one.
Well, in 10 years' time, I hope we have already made some impact on reducing diabetes in the world.
Yeah, this would be amazing if you can create a remission of diabetes. That's fantastic. We know so many people, especially in the Middle East, who are all suffering from it.
And doesn't matter, princes or kings or whoever, it can hit anyone. So it really doesn't matter from which part of society you're coming from.
Yeah, exactly. So we'd also like to offer new apps for people who are interested in healthy living and longevity in the future.
So this is the starting. So this is your first product, and then you will follow it up with other products.
Yes.
Wow. Also in the sector of health, or you will also expand to other sectors?
No, I think in the health, in healthy living, yeah, and longevity.
Perfect.
And Paulina, how about support? Are you currently looking for investors, partners, healthcare providers to collaborate with you?
Yes, and they can contact me directly for further discussions then. Yeah.
So all of them. So
Yeah.
also healthcare providers. Are you also talking to insurance companies?
Not yet, but we could, yeah. But first of all, we need some potential investors or partners.
Okay.
Okay, Paulina, and how much are you raising?
We are raising $2 million.
And what are you? What is the use of these funds? Like, what do you intend to make with this money? Is it for the app, or is it for marketing, or what is exactly the use of these funds?
Most of it's for the marketing because we are finalizing the application just now, and but we will work more on it. So it's for that as well.
And what excites you the most about the future of digital health? And how do you see Olakino shaping that future?
Well, it's only now that we do have this access to data and the biomarkers that would have been impossible to get a few years earlier. Before, like, you needed laboratories and testing facilities, and now we can get the same data from wearable devices. With using medical apps like Olakino, you can dramatically help to reduce the general healthcare costs.
Are you yourself using Olakino already, or to test it, or are you using other apps for health?
Yeah, I am testing it, of course. Yeah, but also using other apps. Yeah.
If the Olakino app will tell me to go and take a dip in the water at 4 degrees at minus 14 outside, I'm not going to listen to the app.
Yeah, that's not something it's going to tell
So
you.
how do you deal with such users that are advised, but they actually like, nah? Could the app actually see if the user did fulfill the advice of the app,
Yes.
right? So if advised to walk or to sleep or to have a dip in the water, in the sea, like, can it really know, okay, there was some action, right? So, or not? Can it be monitored somehow that people are acting on the advices?
Yeah, of course, it monitors through the devices what you're doing, like Apple Watch. or Oura Ring, and through there you can get the information. Yeah.
Do you need to wear 24 hours this ring, or how does it work?
No, you don't have to, but I do wear it always.
Okay. And it does the same as Apple Watch. So basically you don't need the Apple Watch then. Or you need it also.
Yeah, there are a bit differences. But this Oura Ring is really good for monitoring your sleep, I think. Personally, I like it because of that.
Okay.
And so if some viewers would like to try Olakino app and take control of their health, where should they go? Where do they find it?
Okay, so we will ship in a few months' time. And the first place where you can get it is from Apple App Store.
Okay.
And it will be a free app, or it will be already from the beginning a paid app?
There will be some version which is free to start with, and then AI, for example, is you have to pay for it.
Okay. No, that makes sense. So you have a kind of free version for the normal public, and then people who want extra, they have to pay. That's absolutely perfect.
And for those watching and who want to start taking charge of their health today, what's one piece of advice you personally would give them?
Okay, I would say that start with small steps and increase your daily movement. Pay attention to regular sleep rhythm. Eat clean and nourishing food, and don't forget to laugh and have fun.
That's most important. So,
Yeah.
and finally, for all our viewers who want to take charge of their health, what would be your call to action?
Keep moving every day.
Perfect.
The movement is all, and everything is changing, right? So that's perfect.
I'm just worried about this 4th degree. I'm still thinking about this.
He's shocked under deep impression. So maybe you can tell us, how did you get there? I mean, that you started taking such deep. So was it from the childhood that it's so natural, or you needed to make some steps to reach to that level that you can go in minus 14 degrees? Now I take a dip,
Yeah.
How did that happen?
Yeah. Well, obviously you get used to it when you do it regularly. So that's how I have been doing it, maybe regularly, maybe 5 years.
Well, and by regular, you mean once in a week, once in a month?
No, maybe 4 times a week or more.
Wow. Okay, you have all my respect.
But it's actually nowadays really common to do it in Finland. There's lots of people doing it. So,
I mean, I used to do it in Finland, but that was with sauna. So you are in the sauna, then you run into the water at 4 and then run back to the sauna. But you just go swimming and you don't do sauna.
Yeah, I just go swimming. Yeah, I prefer it that way. But you can do also that with sauna as well.
Yeah, because that somehow warms you up, sort of.
Wow, so amazing. Thanks so much, Paulina, for joining us today and inspiring people to move and to act towards their health. And we are really looking forward to see in a couple of months the app and try it out. So then we'll go to the lake, still will be cold, and we will measure, okay, did it change something
in a
here?
couple of months, it will be summer here.
Thanks, Paulina.
Okay, thank you for having me.
So the technology is not just about automation or efficiency. It's about empowering lives, as we see. And Olakino is doing just that. So subscribe and maybe to our newsletter that we will inform when the app is released. So you will be ready to try it out.
Perfect. So stay healthy, stay inspired, and see you in our next episode of Swiss Impact with Banerjees. Bye for now.
Bye for now.
What an inspiring conversation. Impact investing is more than just finance. It's about shaping the world we want to live in.
If this episode sparked new ideas or possibilities for you, don't keep it to yourself. Get involved.
Subscribe for more powerful insights. Follow us on social media and be part of this movement.
Are you an investor making a difference? We'd love to feature your story in our next episode. Reach out and join us.
Let's build a better, more sustainable world, isn't it? Together. See you in the next episode.